Hi, Dr. Paul here. A common question I get is, when do you recommend a psychologist? When do you recommend medications? So one thing to make very clear, I'm not I'm not anti-therapy. I'm very pro-therapy. Um, and everyone thinks, oh, he's just all about medication. All he talks about is medications all the time. Well, that's my job. It's what I do. It's my full-time job. So yeah, I talk about them a lot because it's what I do. Am I a therapist? No. Now, do I? A lot of people see me and they think, "Oh, you're like a therapist. You listen to me. You listen to you give me advice." I go, "Yeah, I give practical advice, but I'm not a therapist." And so when I talk about medication, they're extremely important. When does therapy? And again, I talk to all my patients about exercising if they're not doing it, and some just won't do it. But I've talked to them about how that's good for their stress to be active. So when people think, oh, you're all about meds, no, I'm not. I talk about their exercise. I talk about therapy. Now, when therapy? Well, therapy probably more is if there's some underlying major issues going on, either family issues growing up, parent issues, relationship issues. So when there's stuff going on in their life, a therapist can be very helpful. We get a question about which type of therapy. The most common we call CBT, which is called cognitive behavioral therapy. I'm not an expert on that because I don't do it. If you want to learn more about that, I did a video with Kim Quickel, Quickkel, Kim, and she's a therapist I worked with for like 30 some years now, and she explains CBT about how basically it's kind of like a therapy that has to do with rationality and basically explaining like that. Kim said I think something about like if someone's afraid of flying. You talk about, the safety. Anyway, that's an example. You talk about statistic and the safety and all that. But sometimes that doesn't help. Again, flying is a tough one for people. But CBT can really definitely get to people's core issues. Where do medications come in? Well, medications come in when there's a medical condition, a component of it. And I'm very good at figuring that out, whether there's and again, part of it has to do with if you suspect it, try treating it and see what happens. If you try medication, that'll answer the question is there a chemical component or not? It's trial and error because with this field of medicine, we don't have blood tests to check the levels. We can't check serotonin levels or dopamine levels. It doesn't work that way. So we have to have a good guess, a good feel for it to choose correctly what to treat here, and that's how we know if medications are right, is if they respond well. Now, if we try medication, they don't do well with them, and I try this or I try that, and maybe medications aren't for that person then. But very often they are, and the statistics show that when you combine CBT and medication, the results are better than either alone, because now you're getting to all the components. You're getting to the behavioral, the cognitive part. You're getting the chemical part, the medical part. So oftentimes when you combine them, that's where you get the best results. And there's also other kinds of therapy. There's EMDR for PTSD. There's exposure therapy. Kim talks about that in her video. So there's a lot of different types of therapy for different types of people. DBT, dialectical behavioral therapy, is very good if someone has like a borderline personality disorder. So depending on the situation, we can determine like which type of therapy might be the best for a person. So, but at the end of the day, whether it's medications, therapy, combination of both, whatever really is best for that person, and that's figured out over time, a little bit trial and error, and it's pretty easy to figure that out.